The inferior alveolar nerve block, my absolute favorite injection and others' worst nightmare. I'm going to go over ways that we can inject properly, painlessly, and confidently. The first thing that I do is find my landmarks, and I always look for the pterygomandibular fold first, and once I have found it, I can then map out my target spot for insertion. Before picking up your syringe, you always want to find your target spot using your fingers and a cotton tip applicator. So I'm demonstrating here that I have found my target location for insertion, and I'm going to go over in more details with you how I have discovered this. So always use your fingers, cotton tip applicator first before picking up the syringe for insertion. Place your thumb over the corner of your patient's lip, and you want to put the tip of your tongue at the height of the pterygomandibular fold. I'm going to remove my thumb so that you can see it with the tip of the cotton tip applicator where your point of insertion is. So you want to go up a few millimeters where your thumb is, and that would be your point of insertion there. So you don't want to go too low, because if you do, you're going to hit bone immediately. And if you go too high, you aren't going to hit any bone, because for this injection, you do have to tap the bone prior to depositing. You always want to make sure that your syringe, the barrel of the syringe, is near the premolar area. And that's what I'm indicating here. You want to make sure you're right at the premolar area. I use my pinky as a fulcrum by sticking it straight out, and as I'm inserting, it'll come in contact with the patient's jaw. You want to make sure you have a steady syringe for this injection. So we are now ready for insertion of the needle. And again, you find your target spot and go ahead and insert. My pinky is straight out so that as I'm inserting the needle, it'll come in contact with the patient's jaw, and I establish a fulcrum so that we can have a steady syringe while depositing. You want to use a long needle for this injection because we have to have contact with bone. If you're using a short, you're not going to contact bone. So long needle, contact with bone. Once you contact bone, pull out about 2 millimeters, and then you want to go ahead and aspirate. If you have negative aspiration, you can go ahead and deposit the anesthesia, which I am doing so now. You want to make sure that the barrel of the syringe is right around the premolar area. If you are anterior, you're going to miss your mark. If you're posterior, you're going to miss your mark as well. So just make sure you're in the premolar area, and after you have deposited, you can go ahead and remove the syringe.